Peace to everybody out there. It's your boy Sean P. Lafayette, Jama Boca, ETM Hotel. To everybody out there in the in the YouTube world, in these YouTube streets. You are tuned into the real versus Pfizer versus Moderna, the evidence, with your boy Sean P. Please make sure to like the show, share the show, tell a friend, tell a friend. We are live and in full effect. We black at you with this mRNA information. Before we get started, there's a couple things that I want to touch on real quick. No, remdesivir is not killing people. There's a rumor going around talking about remdesivir is killing people. False. Immunocompromised people who received the third dose, a full dose of the mRNA vaccines, have been protected from severe COVID. That's a good thing. And, they're just going to continue to keep working toward a solution. Now, there's information for people who are interested in that came out of the CDC regarding the third dose, that it guarded immunocompromised from severe COVID. Check that out. There's some experts that are projecting that Omicron will recede more slowly in the US than in other countries because we're disrespectful. We don't respect nature. And other places have been shutting down, closing businesses, schools, and things of that nature, shutting their countries down. And we're operating as if there's no pandemic. And as long as we do that, we're going to continue to have spread the virus. The virus will find a viable host, and we'll continue to have more people infected, which will lead to an increase in hospitalizations because we do have 100 million unvaccinated people, and we will see more deaths. Before the pandemic began, I kept telling people that this was worse than the Spanish flu. And how is it worse than the Spanish flu? People argue me up and down saying that I was incorrect in that, but I was actually accurate. Just within the first year, think about it, there was like 400,000 deaths. But we're at a time in the 2020s, we're at a time where we have better science, better technology, and more hospitals. See, back then with the Spanish flu running rampant, you didn't have the hospitals like we have today, the support, the science, and the technology or communications that we have today. And the worst the Spanish flu did was what it did based on the numbers. Now, when you start comparing that pandemic to this pandemic, you see huge differences. Even with all the tools that we have and the advancements in our healthcare field and science and technology, we're still over 830 something thousand deaths and counting. And that's a problem. So yeah, man, we in the building today. Peace to everybody that's tuned in. T Mula was good. Keenan, Thurman was good. Marlon, peace. Chavis, I see you in the building, throwing up the M's. Everybody, please like the show, share the show. We live. We finna get it in. So I want to take us back to February 24th, 2021. And then I'm going to bring us forward. But I want to take us back to last year. Last year, there was an article published by Yale Medicine. Um, you had three infectious disease experts uh, co-author an article published on Yale Medicine that talked about, um, and then Kathy Catella that talked about comparing the COVID-19 vaccines and how they are different. And in that article that was published February 24th, 2021, they went in and compared the differences in the vaccines, the mix and matches, and so on and so forth. Well, that article was updated January 10th, 2022. So we're going to go back to go forward and then and then get into our argument. We ain't gonna be all day either. We're gonna be nice and right. So um we all know the three vaccines that are in the US. We don't have to go that far. Pfizer was the first COVID vaccine to receive full FDA approval. It is approved for ages 16 and older in the US, and it has an EUA for ages 5 to 15. Those inoculated with Pfizer BioNTech for primary vaccine series who are ages 12 and older can get a Pfizer booster shot 5 months later. Only adults ages 18 and older can choose any of the three COVID vaccines available in the US as a booster shot, regardless of the vaccine used for the primary vaccination. Recommended for children and adults ages 5 and older are eligible for vaccines. Everyone 12 and older should get a booster, according to the CDC, which prefers a Pfizer, BioNTech, Moderna booster in most situations. Anyone ages 5 and up who is moderately or severely immunocompromised may be advised to get a third dose of Pfizer, BioNTech, or Moderna to complete their primary series. This is not to be confused with the booster dose, which is an additional. So immunocompromised have to have a 3-shot series, and it doesn't include the booster. Dosage, 2 shots, 21 days apart, fully effective 2 weeks after second shot. Single shot booster doses can be administered to those who are eligible at least 5 months after completion of their primary dose. Because Pfizer BioNTech says its data shows a smaller dose produces a strong immune response in children. The 10 microgram doses for children ages 5 to 11 is smaller than the 30 microgram doses given to teens and adults. This is where you see the science updating in this particular article from last year to this year because there's more data available regarding the vaccines. It gets into possible side effects, which would be pain, redness, swelling, where the shot was administered, chills, fever, headache, muscle pains, nausea, tiredness throughout the rest of the body. These side effects generally resolve within a day or two of rest, hydration, and medications like just some aspirin. It said Tylenol. Just take some Tylenol. All right. Now, on rare occasions, the vaccines has appeared to trigger anaphylaxis, a severe reaction that is treatable with epinephrine or the drug in epinephrines. For the reason, CDC requires vaccination sites to monitor everyone for 15 minutes after the vaccine. Uh, People with allergies, 30 minutes. The FDA label warnings was placed, right? And they basically are associated with reported cases of heart inflammation in young adults. This inflammation may occur in the heart muscle, which they call myocarditis, or in the upper lining of the heart, pericarditis, and is considered important but uncommon. The inflammation in most cases gets better on its own without medical intervention. So how it works? Well, unlike vaccines that put a weakened or inactivated disease germ into the body, Pfizer mRNA vaccines delivers a tiny piece of genetic code from the SARS-CoV-2 virus to host cells in the body, essentially giving those cells instructions or blueprints for making copies of the spike protein. My bad. Maybe that should be a little bit better. We all should be aware of that. Now the spikes do the work of penetrating and infecting host cells. Those proteins stimulate an immune response, producing antibodies and developing memory cells that will recognize and respond if the body is infected with the actual virus. So how well does it work? We found that out. Initially, in the phase 3 clinical trials, the vaccines were 95% infectious against multiple variants. As new variants proceeded, the vaccine effectiveness waned over a certain period and became weaker. So they began to tweak the vaccine and deal with the data accordingly as it see fits. But the original vaccines that you received, if you have not gotten a booster lately, or if you got your initial shot in 2021, your initial vaccination still protected you against severe disease, hospitalization, and death, which is what the vaccines were designed to do from the beginning. Its infectiousness could wane depending on variants, but it's still protected against infectious disease, the spread of infectious disease, hospitalizations, and death. I don't need to read the article to know how well the vaccines work. How well it works on virus mutations. Well, I just kind of touched on that. And we dealt with how it waned over a period of time and how studies go on and so forth. So as you can see, they updated. So that's Pfizer. So what about Moderna? It's still authorized for emergency use in the US. About a week after Pfizer was authorized, Moderna uses the same mRNA technology as Pfizer, has a similar efficacy in preventing symptomatic disease. It also needs to be stored in freezer level temperatures. In August, the FDA approved the third dose for Moderna vaccines for immunocompromised individuals, including solid organ transplant recipients and those with conditions that give them an equally reduced ability to fight infectious and other diseases. As of the status of Moderna, emergency use in the US for the vaccine, as well as half-dose boosters for all adults older than 18, at least 5 months after their initial Pfizer or Moderna shot, or 2 months after their Johnson & Johnson shot. So look, they recommend a booster shot 2 months after your initial Johnson & Johnson shot, for those of you who didn't know. And they prefer you to mix and match. So it's recommended for 18 years and older. It is recommended for anyone 18 years or older, 5 months, and the booster is recommended for anyone 18 years or older after 5 months. However, if you completed the 2-dose regimen, which are 28 days apart, fully effective 2 weeks after second dose, you're 25 weeks, you're 5 extra weeks out than Pfizer from when you are eligible, booster eligible. But they'll say 5 weeks to match Pfizer's, but Moderna's is actually 25 weeks. So 20 weeks after your second vaccination, well, after your second vaccination, and those 2 weeks prior to that, 20 weeks from the 14-day period after the second dose, Pfizer recommends a booster. All right. 25 weeks after your 14 days of your second dose, Moderna eligibility for booster shot is in effect. So protection against infectious disease, hospitalizations, and death is still there. However, the waning protection rescinds after that period of time per se. But the vaccines are still effective whether you get a booster or not at preventing disease. Of course, the side effects are similar to Pfizer. Side effects includes chills, headaches, pain, tiredness, redness at the swelling of injection site, which will normally resolve in a day or two. On rare occasions, mRNA vaccines have appeared to trigger anaphylaxis, severe reactions treatable with the drug EPINs. For that reason, the CDC requires you to sit at the site for 15 minutes, 30 minutes if you have severe allergies. The FDA warning label is similar to that of Pfizer. It says Moderna vaccine likely associated with reported cases of heart inflammation in young adults, which is myocarditis or pericarditis, and is considered important but uncommon. The inflammation in most cases gets better on its own without treatment. All right. How it works, similar to Pfizer vaccine. This is an mRNA vaccine that sends the body cells instructions for spike protein and otherwise. We have the scientific data to deal with everything that's actually going on, and it works well. How does it work well against other variants? Well, we knew after Delta that Moderna was working better than Pfizer. It was more infectious against Delta than Pfizer, and therefore the argument begins. No, I'm not talking about Johnson and Johnson. So on the 20th of this year, comparisons of mRNA vaccines on breakthrough SARS-CoV-2 infections, hospitalizations, and death during Delta predominant period, a study was published. We're not going to get into the heart of the study. We're going to deal with the specifics of the study because we have more to go. Immune responses to Moderna's vaccine and Pfizer's vaccines declined by 6 months after vaccination, although antibody titers are higher with mRNA 1273. If you're unfamiliar with mRNA 1273, that is Moderna. So your antibody titers are higher with Moderna. Comparisons of vaccinated non-immunocompromised adults showed lower risk of hospitalizations for recipients who received Moderna than Pfizer. During March to August, this study examined breakthrough infections, hospitalizations, and mortality in a general population for these two vaccines during the Delta period while considering risk characteristics of vaccine recipients and the varying time since vaccination. This is the real Verzuz. I'm not going to get too much into the methods. I left you all the sourced material available for you to want to go back and you want to scrutinize what I am talking about. You will have the ability to be able to do that. However, I am willing to give you the results. Moderna's cohort included 62,628, was significantly older and had more comorbidities than Pfizer's 574,538, and the differences decreased after matching. The monthly incidence rate of breakthrough infections increased from July to November 2021 in both cohorts, was higher in Pfizer's cohort than Moderna's cohort, and reached 2.8 and 1.6 per 1,000 person days in November. So let me give you what this is actually saying. This is telling us that breakthrough infections per 1,000 people was at a 2.8% higher than Moderna's 1.6. So there was a 1.2 per 1,000 person vaccinated difference. After matching, the Moderna cohort had a significantly lower hazard for breakthrough infections compared with the matched Pfizer cohort. Among infected patients, Moderna recipients were older than Pfizer recipients. I'm going to say that again. Among infected patients, Moderna recipients were older than Pfizer recipients, differed in sex and racial and ethnic composition, and had significantly more comorbidities and adverse social determinants of health, but differences were no longer significant after matching. The 60-day hospitalization risk was 12.7 for Moderna recipients and 13% for Pfizer recipients. The 60-day mortality was 1.14% and 1.10% for Moderna and Pfizer recipients, respectively. Among the matched cohorts, Moderna recipients had a lower risk of 60-day hospitalizations than Pfizer recipients. No significant difference was observed for mortality. So, based on breakthrough infection and hospitalizations, since there was no difference in deaths, we have the data. This was published recently. You may see it circulating on social media as of today. This article was published, yesterday. It was published by Tim Hooser, fact-checked by Jessica Beek, PhD. It says that COVID-19 Moderna vaccine may reduce infection risk more than Pfizer. The Moderna and Pfizer vaccines have been highly effective at preventing COVID-19. In a new study, researchers looked at the differences in effectiveness between the two vaccines. They found that people who had received 2 doses of Moderna were less likely to develop COVID-19 or become hospitalized with the illness than people who had received Pfizer's vaccine. Don't get me wrong. Both the Moderna and Pfizer COVID-19 vaccines, or mRNA vaccines, are relatively a new type of vaccine technology. These COVID-19 vaccines work. It's just a fact, they work. By providing our cells with instructions for making SARS-CoV-2 protein, our immune system then reacts to these proteins and develop these tools to respond to any infection with the virus in the future. No matter the variant, scientists from the CDC have found both the Moderna and Pfizer's are very effective at protecting people from COVID-19. CDC Director Dr. Walensky points to accumulating evidence that mRNA COVID-19 vaccines are effective and should prevent most infections. She adds that fully vaccinated people who still get COVID-19 are likely to have milder and shorter illnesses and appear to be less likely to spread the virus to others. These benefits are another important reason to get vaccinated. So, in the latest study, researchers investigated the differences in breakthrough cases. All right, dealing with Moderna and Pfizer, we basically ran through that with the JAMA source. So they pulled this from the JAMA source. What was uncovered again is what was iterated already. There was lower risk with Moderna. The researchers found that in November, there were 2.8 breakthrough cases of COVID-19 in people fully vaccinated with Pfizer vaccine per 1,000 people. That included breakthrough cases if people had not received the booster vaccination or had not had prior record infection with SARS-CoV-2. For Moderna vaccine, the monthly figure was significantly lower at 1.6 breakthrough cases per 1,000 people who received these shots. The risk of hospitalization in the 60 days after infections was also lower for people fully vaccinated with Moderna versus Pfizer by 0.6% difference. The researchers did not see a significant difference in mortality rates between the two vaccine groups. That's a good thing. The rest of this is basically some conversations about other recipients. I don't really want to get too much into that. At the heart or the root of the articles is basically throw your M's up. Now, could we attribute a higher vaccine dosage in Moderna versus Pfizer? It could be the difference. That could be the major difference between Pfizer and Moderna is the fact that with with Pfizer you get 0.30 micrograms, and then it's a 0.50 with Moderna. But Pfizer's vaccine shots are 21 days apart, and Moderna's is 28 days apart, an additional week. Could that distance between vaccines make a significant change in protection? Because it allows more time, right, for the immune system to develop an actual immune response. So by the time you get the second vaccine, it triggers that same immune response again, building up more memory. Whereas in Pfizer, it's a week less. So just based on the data from the previous study and the information that we have available to us, it is safe to say that Moderna, yes, is a far better vaccine than Pfizer. Yet, both protect against the spread of infectious disease, hospitalizations, and death despite the variant type. Whether you get another vaccine or if you get a booster shot or not, your initial protection still your initial vaccination provides you protection against the spread of infectious disease, hospitalizations, and death. However, however, that is to say, not to say don't get a booster, because I'm not going to tell you that, but it is to say that, your waning protection it may occur. They're still doing studies. But as of right now, Big M Gang is winning the versus battle. So after a whole year for us, 2 years for the people that was involved in the original studies, Big M is in the building. Little P can have a seat. I know y'all are hearing news today about, or the last couple of days about a subtype of Omicron, and it may be more infectious or potential breakthrough. However, people who have caught COVID lately due to Omicron are still subjected to potential reinfection because of the evasiveness. Now, I want you to remember this: the evasiveness of the spike. Remember, natural infection does not train your immune system to recognize the infectious part of the spike. You don't get that. Only the vaccines, only the vaccines, right? Train your immune system to recognize the spike. I'm gonna say that one time for the people in the back who don't understand what I'm saying. When you are naturally infected with the virus, your immune system is not trained to recognize the spike, but only recognize the threat of the spread of its disease. If I'm saying that correctly for some, you can correct me if I'm not. But the vaccine trains your immune system to recognize the spike. That is the difference between the vaccine's protection and natural infection. So you can continue to be infected with different variant types. All the people out there that says I'm more naturally infected, which can cause more harm and potentially the spread of a infectious disease and death. That's the risk that you take. That is why they say hybrid immunity is the best immunity. because you've been infected naturally with COVID and then you've had the vaccine. So your immune system has been trained to recognize the full spectrum of the virus, whether it be the spike or whether it be the other things that come behind the virus infection. Your immune system is now trained. So this is why you have people like Vincent Yellow, top virologists, saying that in a matter of 5 years, we ain't gonna need a booster shot. We vaccinated people can sit here and hey, go on about our natural days, and we can allow the infection from nature to boost our protection because we do not succumb to ding, 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 severe disease, hospitalizations, and death. So this is critical information for those of you who want to know, why should I be vaccinated? Because of the protection level that you receive from the vaccination is greater than that of the natural infection. Well, Sean, what was the CDC talking about when they were talking about natural immunity was doing better than so on and so forth? Nah, 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 nah. You read it wrong. The CDC even corrected themselves. They were not telling you that natural immunity was performing better. No, 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 no. I'm not going to get into the actual details because we did this on a show before. Natural infection is dangerous. However, we all understand that if you have overcome the virus at some degree, you have some type of afforded protection, but you know, you still want to get vaccinated. But why? Because getting vaccinated is going to help. I don't want to slow them down, bro. I don't want to slow them down, bro. They jumped the gun with the whole science. If Cedric was in the building right now, he'll be laughing at you right now because he would seriously tell you like, "Hey, look, go back and see what the CDC is saying to everyone." He would tell you that. He would say, "Hey, look, this is proof positive that people were reading the actual science incorrect, right?" I'm still trying to find out if hold up. Hold on 1 second, y'all. I'm trying to answer. She said, "Are we good?" Oh, okay. She was asking me, was it good? Okay, on the title. So look, I'm answering something for the doctor who I'm supposed to be live with later on today at 7 p.m. Central, 8 p.m. Eastern, Dr. Linda. You may have seen us on the show before together. But yeah, she's gonna be interviewing me about the book, and we're gonna have some conversations. So let me see here. Hold on 1 second. I'm gonna pull up something for y'all. And I didn't want to do this because I felt like, you know, we already understood, right? We understood that what the studies was actually saying about this whole natural infectious thing and protection. I really thought that we did. So I'm gonna go to a more simpler form of an article that Cedric actually had that was produced by Dr. Syed MD. He similar to what is it? Our local epidemiologists. Um, they do work on there that actually help people. Let me see. They update the information regularly, so you'll get email updates and things of that nature. So let me go back because I'm on a newsletter thing, and let me pull this up. See, he just sent me something else. Y'all can't see my screen, so y'all don't know what the hell I'm talking about. I'm gonna get in this and then I'm gonna digress. He says, so, hi everyone. I'm sure you've seen tweets and other posts like the following on social media news. Breaking. CDC study finds natural immunity provides significantly more protection than mRNA pre-treatment alone. This refers to a recent CDC study that examined COVID cases and hospitalizations in New York and California by vaccination status. Anti-vaxxers have seized that study to say, oh, look, the CDC finally admits natural immunity is better than the vaccine. Oh, no. This is a massive misrepresentation. The CDC even had to put out a statement to clarify this. This is the link to the CDC statement. It says, let's talk about it. But before that, let me briefly tell you what this study found. Basically, the study looked at COVID-19 cases and hospitalizations in California and New York from May to November before and after the Delta variant was dominant in the US. Here's the figures here. I won't bore you with the actual numbers, but basically what they found was the following. Throughout the study period, COVID cases and hospitalizations were highest in people that were unvaccinated and never had COVID before. Big surprise here. The graph above is striking representation of this. Compared to those unvaccinated with no prior COVID vaccine, no infection, people had much lower case rates, 20 times lower. Not vaccinated, but with prior infection, 7 to 10 times lower. Vaccinated and prior infection, 9 to 10 times lower. Once the Delta variant became dominant in the fall, the numbers flipped compared to the unvaccinated without prior infection. Those unvaccinated with prior infection had lower case rates, 15 to 29 times lower than those who were vaccinated but did not have a prior infection, 6 times lower. However, during the time Delta was dominant, those that were vaccinated and prior COVID infection had significantly reduced cases, 20 to 30 times lower compared to the unvaccinated without prior COVID infection and those who were unvaccinated but had had COVID before. Anti-vaxxers have run with the above results, proudly proclaiming that the CDC finally admits that natural immunity is better than the vaccine. But in true fashion, they misrepresented the study and conveniently omit some very important points that we all need to consider. First, I think it's funny that these folks suddenly trust the CDC when during this entire pandemic, they've been slamming the agency and consistently refusing to believe all of the pro vaccine studies they have put out. Second, all immunity is natural, whether from infection or the vaccine. I'm going to let that sink in. I'm going to say that very slowly one more time for all my natural people out there. First, I think it's funny that these folks suddenly trust the CDC when during the entire pandemic, they've been slamming the agency and consistently refusing to believe all of the pro vaccine studies they have put out. Second, all immunity is natural, whether from infection or the vaccine. No one has denied the existence of immunity from prior infection. No one has ever denied the existence of immunity from infection. We know that infection does provide some degree of immunity. We just don't know how long that lasts or how durable it is, or if everyone will get the same degree of immunity. The vaccine, on the other hand, generates immunity that is robust, reliable, and consistent. COVID infection is a risky way to get immunity. 800 and how many? 850,000 people did not survive. Third, immunity from COVID infection is not without risk. You only get immunity if you survive COVID infection. The study appropriately calls people with prior infection COVID survivors. The 850,000 plus people who have died in the US from COVID are not around to tell you their side of the story. Moreover, you also put yourself at risk of complications from COVID infection, such as lasting organ damage and long COVID, which can be debilitating. Millions of people in the US are far more worldwide are suffering from long COVID, and we still don't have a good treatment for them yet. The vaccine is much safer way to gain immunity without putting yourself at risk of death from COVID or the complications of COVID, including long COVID. Vaccine immunity tends to wane over time. Third, what these folks don't tell you, which the above data show you, is that before Delta became predominant, immunity from prior infection was inferior to vaccines. Let me answer this. Teddy says, why is it so hard to find Moderna? I always see Pfizer. You got to go to vaccine.gov, put in your zip code, and narrow your search down to Moderna. When you narrow your search down to Moderna, it's going to show you Moderna in whatever radius that you selected. That is exactly what I did. And I literally found Moderna zero point 0.6 miles from my house. It's really like 0.8. Once the Delta variant became that was for booster. Once the Delta variant become dominant, we started to learn that the people that had been vaccinated several months ago were starting to have waning immunity to infection. And because some of these folks didn't have the immunity from having had infection, they were at higher risk of catching COVID, but were still protected from what? Severe disease, hospitalizations, and death, thanks to the vaccine. The study did not evaluate the efficacy of booster doses. Going on from the last point, this study did not evaluate the effectiveness of booster doses because they were not widely implemented during the study period. We know 4 to 6 months after a second dose vaccine, immunity tends to decrease. This is not a big surprise or a hidden thing. Getting a booster dose significantly improves that protection. If this study had evaluated the impact of booster doses, we may have had different results. There was no details of severity of infection in the study. From this study alone, we do not have any details of the severity of infection of the people who were infected. This is important because you only have mild infection. You may have not generated a robust immune response as someone who have had a bad case of COVID. Further, there are people, small studies show this, that do not generate any significant immune response at all from natural infection. We have the studies that show that 36% of the people might not have no immune response. On the other hand, except in the immunocompromised, the vaccines generate robust, reliable, consistent immunity across the board. Hybrid immunity. You heard me mention this. The study found that getting vaccinated and having had infection provides the best protection. Anti-vaxxers won't point that fact out. Why? Because it encourages people to get vaccinated. This study is not applicable to the Omicron variant. This is perhaps the most relevant point here. The Omicron variant is now responsible for 95% of all cases in the US. The CDC study is only applicable for the time before Omicron. This is strong evidence at this point that prior infection does not provide significant protection against Omicron variant. The Omicron variant has significant immune escape, meaning it can evade the body's defenses. While immunity from the two-dose vaccine is also reduced, it shoots right back up after a booster dose. This is an excellent review by Dr. Topol. So if you hear anyone touting this study as a reason not to get vaccinated, please tell them it does not apply in current times because this study is not relevant to Omicron variant. Bottom line, here's the bottom line. You do get immunity from natural infection, but it is likely not as reliable, robust, or consistent as the vaccine. Not everyone who gets COVID will get the same degree of protection. COVID infection carries significant risk, including death, complications, and very important long COVID, which is going to be a chronic illness for millions of people. This study does not apply to the Omicron variant, which is what we're dealing with now. Prior infection does not protect significantly against Omicron, and the best way to be protected is to be vaccinated, plus booster if eligible. It's all about considering the risk of COVID infection versus the vaccine, and the vaccine is much safer way to gain protection with a significant reduced risk of infection, complications, and long COVID. And please, for the love of God, well, where my sister at that was on my post arguing? K, Sister K, if you listening, I'm gonna pull this for you and just so you'll have it. Please do not try to get COVID on purpose to get natural immunity. It is a really bad idea and can kill you. That's the simplest form of the actual article that was wrote. You know, um, Cedric sent me to it, but I know he didn't know that I was already getting emails um, from the same person. So it's cool to see that, people are being proactive that we rock with that actually not only support our books, but are also engulfed in trying to learn more on a day-to-day basis about what's going on with the pandemic. But more importantly, Sister Bonita, who was in the chat, Sister Bonita was in the chat, sent me a video from the UK doctor that was talking, about natural immunity and so on and so forth. And I was like, oh Lord, here we go again with this guy. He's the only one having a conversation. There's no one challenging his work. So it behooves me, and by the way, I'm in Facebook jail, but it behooves me for another 36 hours or however long, 2 days basically. But it behooves me that he's the only one talking about things and he says it in a way that actually doesn't make sense at all to many people. So all right. I want to show y'all something. So in this video right here, on a live stream, Sister K says he don't know nothing about what he's talking about, shaking my head. I don't know who laughed at the comment. Oh, I knew she did. But if we go down here, watch this. She arguing back and forth, up and down. She says, what she said at? She calling people stupid. She talk about Bill Gates. She do all of that in here. I make sure to expose myself to COVID to gain antibodies, and I thrive through it because my eating is a keto, carnivore, healthy, nutrient-dense foods. She said all this bull crap right here. She said she literally made sure that she exposed herself. It gets, if you don't believe me, it gets worse. Wait till I find her, or is it down here? Where is it at? She said something. She said it on here. She said she caught Delta and she exposed herself to Omicron. I ain't making this up. She said it somewhere on this post. Wait till I find it. She out her mind, that shit crazy. On here lying, I told her I don't believe nothing she say. You guys are lost. It's a lot of fake media. She say all of this. But she said it on here, man. I know she did. I know she just didn't say that one little statement where she just exposed herself. She either went back and deleted her comment, or I'm missing the hell out of it. Chavis was on the post. I swear, I think because she said something behind us, but I think she yeah, because look, some of her comments are missing, y'all. This ain't her last comment. This is not her last comment. Because she specifically told us that she caught Delta. Yeah, there you go. Here you go. Here you go. Damn, it's right in my face. I got both the Delta and Omicron and looking forward to the next because it was the best sleep I've ever had. Fuck the poison. Let me zoom in. Here she go. I got both the Delta and Omicron and looking forward to the next because it was the best sleep I ever had. So I'm going to simply drop this off to her. You know, I want to tag her again. And I'm going to give you this. Oh, yeah, that's right. I can't post it. Look, I'm in Facebook jail. Can't do it. 33 hours. Can't do nothing for 33 hours. Yep. Facebook jail. Oh, well. Yeah, she's beyond a big dummy. Yeah, I forgot, man. Forgot I was in jail. They put me in Facebook jail because I told your boy Stereo that if he tried to use some false information about the vaccines, like the CDC study, that I was gonna kill him. Now, I wasn't necessarily saying that I would kill him, that I would kill him with his information if he tried to pull that study out. I was gonna beat him down. But unfortunately, okay, she still posted it wrong. All right, she working on it. Okay. So they found my comment offensive enough to put me in Facebook jail, which would basically have been for 2 days. The problem is that it begins at the time they actually struck the comment, and that was during Chill's live, so it might have been 8 p.m. So in about, I think, less than 8 hours from now or whatever, when it get about 8 p.m. my time, it's going to be 24 hours from that time. So really, they really got me for 3 days. Yeah, they put me on 3 days, not 48 hours. They put me on 3 days, so I ain't gonna be able to comment until Saturday. It is what it is. So tonight's show, I will be with Dr. Linda. We gonna get into it. If you don't know who Dr. Linda is, you should know who she is, because I tried to show it to y'all before on this channel. When I uploaded a video, I'm gonna be doing an interview with her. She should have both of her books today. I probably have to check with her. And we're going to get into what SARS-CoV-2 taught me, but pretty much more fact versus fiction. So this concludes our conversation today. Yeah, free me, man. Free me. I need y'all help, man. I'm gonna be interviewing with another doctor. You know what I'm saying? I was on Chill Talk with Dr. Cole, which is my girl. You know what I'm saying? No disrespect in that way. You know what I mean? I love Dr. Cole. She does good work. She's very supportive. She's straight to the point. She don't sugarcoat nothing. She gonna shoot it from the hip, and she don't play the nonsense. She let me deal with the nonsense. Dr. Linda. All right, y'all don't know nothing about Dr. Linda. Let me see if I can pull a little bit up Dr. Linda real quick. She be live at times, but on that last video that I did with Dr. Linda, she was going in. Are we gonna get it in? And she has a like page on Facebook. She a Delta, so you gonna see a sorority crap. I mean stuff, not crap. And she be selfieing it up. She be selfieing it up. But she hit you with them straight facts. So Dr. Hayes is who we gonna be dealing with today. We're gonna get directly into the business, and we're gonna handle it like real people handle their business. And we gonna make sure that we're successful in it. As I get the link and the information, I'm gonna throw it out there to y'all, and we're gonna go through there and deal with it, how we need to deal with it. And we're gonna get in some fact versus fictions, and we're gonna hash things out and educate our people, man. So we look forward to having y'all on. We look forward to people joining the discussion. Please bring your questions, comments, and concerns. If you know any anti-vaxxers who still have questions just to have questions, or they have questions that they need answers to, make sure that you share that information with them, so that we can get them in the building, and we're going to deal with it the way that we deal with it. But Dr. Hayes is legit. She in the fight. If you think she ain't in the fight, I'm going to show you she in the fight. I'm going to show you she in the fight. So I just ain't dealing with somebody who just is a self-proclaimed doctor. I'm not dealing with somebody that got a doctor by their name and they just earned it. I'm dealing with real doctors. I'm dealing with real doctors. Here I am waiting on you all to get vaxxed and boosted. Some of you are just begging me to put on a PAPRA and intubate you. FYI, you don't get to pick which variant you get. Here she go. Sauced up. You see her. Dr. Hayes. Let's check her video out. This is when she got vaccinated. I mean, hold up. Yeah.
Is that enough room? We need me up there.
Okay, take it slow. One step at a time. There's enough circulation. We'll get there. There we go. Okay. Yeah.
You good. That's it.
That's it.
Guys.
Got it done.
First one done.
The thing is, so you married?
Mm-hmm.
You do this for him.
Yep.
Kids,
Yep.
you do this for them.
Yeah, that's right.
It's just changing your perspective. A lot of people, I don't want to do it. I don't want to do it because it's not about you. It's about them.
About them. That's what it said.
About
That's what
them.
the man said. He's the one.
Nah, it's because he couldn't get a sleeve up.
You're my guest. 15 minutes. So 15 at 3:15.
Okay. Awesome.
So she in there about that action, boss. Right? So we gonna be dealing with Dr. Hayes. She about her business, man. She telling you get vaccinated. There she go. Now this ain't no fake MD. It's the real deal, doc. We dealing with it. We dealing with it. Yep, and she be on the local epidemiology tip too. So we dealing with it. This who I'll be having a discussion with today. We're gonna get it in and make sure you stay tuned to catch up with everything else we got going on, man. Straight like that. Appreciate everybody tuning in. Like the show, share the show, tell a friend, and make sure you're in the building tonight with me and Dr. Hayes. Peace out.